I really appreciate the presentation and the work that we've done in producing these biannual reports and the monthly reports that are up there. And I really appreciate the community concern and the highlight that people have made this. And to the people who testified today about finding needles or about having coworkers who have found needles, take that very seriously. To the extent that the syringe services program is contributing to that, we don't know. We do know that in 2012, California law changed. And in 2012, you could get a needle without a prescription at a pharmacy. That changed. And we started hearing about these increased number of needles found in public places, and there was concerns raised about the needle exchange program. By 2013, we took over that program. And what we heard is there has to be better accountability, there has to be better data, you have to make sure it's one-on-one giving out. And I feel confident about not only the numbers that we get, but the way in which they're done. I share the concerns that it's not necessary to count each individual needle, but that you can do that through weighing. That is, given the limited amount of resources we have, that seems to make some sense. It's hard to know about what the needles found in public places data really is. Some of the people who collect these are rigorous in the way in which they count their needles. And I've had some experience where it's less rigorous. So it's, to my colleagues' points, is what number would you put in a report, it becomes challenging. If we're trying to reach a level of data that we can feel confident about, let's work towards getting that. And there may be ways to do that, and maybe it's some public health training for the needle solutions team. Maybe there's work that we can do with our other jurisdictions to help in making sure that everything is recorded accurately in different ways. I think that makes some sense, because the idea of including in the report and talking about the public health concerns, I think that makes sense too. I also think that, as I mentioned in 2012, with the law changing, it also coincided with a national epidemic of a rise in opioid and heroin use. And we've seen the statistics. It would be hard-pressed to not look in a paper on a regular basis or read a magazine or watch TV and not see this problem. As my colleague said, the entire State of the State speech in Vermont a couple years ago was devoted to just this, because previous heroin epidemics have been urban phenomena, inner city phenomena, and the heroin epidemic of this century is a rural phenomenon, it is a urban phenomenon, it is an everywhere phenomenon. And we saw the devastation that it took place in Scott County, Indiana, when they didn't have a program. And it took a while for officials there to agree that there was good public health data that could help save lives and stop the spread of disease. I do think, though, that we should also take into account sort of what we've tried to do. We've took over this program. We've worked hard to create additional data. Some of us have served on the Central Coast Alliance for Health, and in there, trying to work with our large Medi-Cal population to try to stem the flow of people having an opioid addiction. They invested in a treatment program to get the highest users of opioids to move to acupuncture. That is a creative way, to me, to say, let's move people off this drug in which they become addicted to. We need to expand those kind of efforts. As was mentioned, we were the first county in California. I don't know whether we were the first in the nation, but we were the first county in California to pass this extended producer ordinance so the makers of these products have some responsibility for the cleanup of these products. And I'm glad to hear that the other cities are moving towards this as well in their different stages. I would also encourage that those cities get these kiosks. The county has placed them in places where we've heard about needles being dropped in public places. And if I found more in my district, we would put in another kiosk there. I encourage our partner in the cities to also do the same thing. If there are places, whether they be parking lots, libraries, or parks, let's get those kiosks there and try to work to have those placed in a safe place so individuals don't have to pick them up. We have also, in the last couple of years, tried to increase the resources for people seeking treatment in Santa Cruz County. Last year, 18 months ago, we began this process in the Drug Medi-Cal Waiver Program, recognizing that we needed to increase the number of treatment slots available for people, because if someone were to come to the Syringe Services Program today, says, I'm ready for treatment, they may have to wait months till they can get into a program. We need to do better about that, and the Drug Medi-Cal Waiver Program helps us do that. Earlier today, we heard about the Whole Person Care Project, and while we haven't received final okay of that, that is another way in which we're working to expand treatment slots. We know that that is the solution to this public health crisis. So it's, the county is trying to take a leadership role in this. I think it would be hard-pressed, and I appreciate the recognition from our partners in the city, and I'm glad that they sit at the table with us for the conversation about this program. And it doesn't mean that we're done. As the recommendations today means we're going to keep on trying to make the program better. We're going to look for other ways to increase the treatment slots. We are going to try to reach the people who are at risk or are already experiencing this terrible demon of addiction to try to find services. And the only thing I would ask is that to check the cynicism that people have about the county public health department, county government, government as a whole, is that we are trying to do everything we can, and we are continually looking for new ways to do it. Not perfect, not enough, but we're going to keep on pushing on these pieces, and we are backing it up not only with the expertise of our staff, and we have some really good staff working on this, but we're also putting a lot of money into it. I mean, the Whole Person Care, as it was detailed this morning, we have to come up with $10 million. The Drug Medi-Cal Waiver Program, I don't remember the exact figure, but that's millions of dollars for our portion of that. So the last thing I'll say is when you see the healthcare debate being debated at the national level, be aware that there are local consequences more than just whether there's going to be a health exchange and your premiums are going to go up, or whether there's going to be expanded Medicaid or Medi-Cal in California. But programs like the Drug Medi-Cal Waiver Program, programs like the Whole Person Care Project, they're at risk. And so for every step we take forward, if the president decides he made a campaign promise and that's the one he has to keep instead of all the other ones he made, that sets us back. And we're going to try to do everything we can, and we're going to show that we can help move the ball up the field on terms of addressing this issue. So I appreciate the presentation and the work of our staff, the leadership from our department, and the commitment of this board to address the public health crisis, both of the users and the people affected in our community.